You're listening to Speaking of Health and Wellness, the podcast, where we dive into holistic nutrition, biomedical treatments, functional medicine, low toxicant living, and developmental strategies with a special focus on children with complex picky eating, developmental delays, and neurodevelopmental disorders. I'm your host, Shandy Laskey, integrative speech-language pathologist, pediatric feeding specialist, functional nutritional therapy practitioner, and Epidemic Answers certified health coach. Together, we are changing the conversation around how we view, discuss, prevent, and treat these childhood epidemics. I am so honored to have your time and attention today. Thank you for joining me and for all of your support. Please note that this podcast is for educational purposes only and should never be misconstrued as medical advice or a replacement for individualized care from your trusted providers. Now, without any further ado, let's get started. Hello, and welcome to episode 7 of Speaking of Health and Wellness, the podcast. Welcome back if you are returning to listen. I hope that this podcast is resonating with you and supporting you for your child or your family and or your clients, whether you're a parent or professional here. I hope that this is serving you, and I am grateful for your support. Welcome back if you are a returning listener, and welcome again if you are new here. As a heads up, content from today's episode has been pulled from a accompanying blog that I wrote last year in 2020. So if you want more information and a deeper dive into what I'm going to be getting into on the podcast today, definitely check out that accompanying blog on speakingofhealthandwellness.com. Same title, gluten-free, casein-free diets, picky eating, autism, and other neurodevelopmental disorders. What's the connection? Same title. But it's a blog, so you have to scroll a little bit further back. But don't worry, you guys. I'm going to post it in the show notes for you so you can access it quickly and easily. So just look at the show notes for this episode, and it will be there. There are graphics, links to studies, and other resources, as well as even more content that I won't be covering in today's episode, but perhaps will be in future episodes. Okay, so now that you know that there is an accompanying blog for further learning, let's get right into it. We've got a lot to cover in today's episode. We're going to be talking about 5 connections to consider when thinking about gluten-free, casein-free diets for children with complex picky eating and or with developmental delays, autism, and or neurodevelopmental conditions. We're going to talk about what gluten and casein are for those of you who are very beginners into this information. We will be diving into what the gluten-free, casein-free GFCF diet is and some exciting research around it, and the things that you may want to consider before taking on a special diet for your child and or your family. Maybe your child is already currently on a special diet or nutrition protocol and you're here to learn more, or perhaps you're considering or you've considered starting a elimination diet or some type of special diet for your child and family. Gluten-free, casein-free, soy-free, paleo, autoimmune paleo, GAPS, specific carbohydrate diet, low oxalates, low glutamates, low FODMAPs, low salicylates, all of them, right? It's a lot to sort through. And that is why having a trusted source for nutrition guidance during your child and family's journey can save you a lot of time and energy in the long run. My work with families focuses on guiding parents through special diets and holistic nutrition while navigating developmental, feeding, and mealtime challenges through the transition. And while I discourage blanket statements or one-size-fits-all approaches and protocols, most of the children that I see benefit immensely from a gluten-free, casein-free diet as a starting point for some extensive time. In fact, some biomedical doctors who see children who have autism spectrum disorders or ADHDs, some of these biomedical doctors will not even see this child or see a child as their patient until they are already on a gluten and casein-free diet, because it's that foundational for many of these children. That is just a starting point. So the gluten-free, casein-free diet, like I said, it's foundational, and for a lot of these other healing diets, they are, generally speaking, most of them are gluten-free and casein-free. So oftentimes this is very much the starting point, and then the diet can be further tailored to the individual as they move forward. But for many of these children, it's worth at least trialing for essentially all of them. Not all children are going to be profound diet responders, but many are. And so I think it's worth trialing. So anyways, the gluten-free and casein-free diets, they're not only beneficial to children with autism and neurodevelopmental disorders, but also to many of the children who have complex picky eating and severe self-restricted eating habits. And there are many complex picky eaters with and without neurodevelopmental disorders who have these biochemical components involved in their picky eating that cause addictive cravings to gluten and casein, and often other foods. And the research is definitely still emerging, but my experiences with clients continue to wow me with their results and their reported improvements. And I want to shout this information from the rooftops. This is one of those reasons why, I often think that I should continue niching down and serve just kids with complex picky eating and focus just there, or focus just on kids with autism, or just, on one specific neurodevelopmental disorder. But I just can't bring myself to narrow it down just yet to that degree, because it's really such a similar approach. I mean, the very beginning starting points are essentially the same approaches. And so I would just feel like it's not being talked about enough. And especially for those kiddos with complex picky eating, I feel like that biochemical piece is often overlooked, and a lot of good research is starting to come out for kiddos who are on the spectrum. But again, I really want my work to get us thinking beyond just kids on the spectrum, but looking at neurodevelopmental disorders as a spectrum in their own. And whether we put kids with complex picky eating under that or not, they're on their own, kind of spectrum over here. But there are a lot of overlapping connections between these conditions. And I feel like I needed to write a blog to really connect all of those dots, because I felt like it was a bit scattered. And so I feel like that's why I really want to do the same for the podcast too. So most of the children that I see are sensitive to gluten and casein. And oftentimes, they're sensitive to other chemicals or compounds within foods, such as amines or glutamates, salicylates, oxalates, etc. Often, they're very well-intentioned parents. They just don't know. A lot of parents are not fully aware of food's impact, because that's a societal disconnect, if you will. Like a lot of us, you just don't know what you don't know. I've said it before in previous episodes, you just don't know what you don't know until, until you start learning and researching more about it. So there are a variety of food allergy and food sensitivity and intolerance testing that exists. But the best way to really determine if your child is sensitive to a food is through guided and mindful elimination and reintroductions. And I do suggest doing that with a professional, especially if you have a child who is a complex picky eater. So what are gluten and casein? Gluten is the name of the protein group found in wheat, barley, rye, spelt, and oats that are not certified gluten-free. Most people are familiar with gluten and celiac disease, where the individual has an autoimmune disorder response to gluten, and it triggers an antibody response to target that person's small intestinal lining tissue. Notably, children with Down syndrome are predisposed to having celiac disease. The rates of celiac disease are higher in children who have Down syndrome. There's a widespread increase of non-celiac gluten and or wheat intolerance today. This is where an individual would have a delayed immune system response to gluten proteins, and it causes an immune system response similar to an IgE response or a true food allergy, but differing primarily in the severity of the reaction. So it's not an emergency allergy, it's not an anaphylactic allergy, it is a sensitivity or intolerance that is a delayed immune system reaction. Food intolerances and sensitivities are slower to show up, and they're very often overlooked. They are a low-level inflammation. I'm over here doing air quotes as if you can see me. They're a low-level, low-grade inflammation. Casein is a protein molecule found in dairy products. Casein sensitivity is different than lactose intolerance, although the two can coexist. Molecularly, casein and gluten, again, both proteins, they look similar from our body's point of view, and both in excessive amounts can cause inflammation, not just for kids on the spectrum, but for everyone, because in these excessive amounts, they can start to create some wear and tear on the intestinal lining. And if you are not familiar with the concepts of gut health and the gut-brain connection, the microbiome, leaky gut, all of that, please visit the previous episode on how gut health impacts your child's health and development, and it will go deeper into this. But this is a really good follow-up episode on that, because if you've heard that previous episode and now we're thinking about these larger protein molecules that can be a little bit difficult, they're hard to digest for some kiddos for various reasons, that can cause some havoc on that gut lining. So children on the spectrum, as well as other neurodevelopmental disorders, they tend to be in this chronic state of inflammation, remember, because the central nervous system is impacted. That is correlated with our immune system, our endocrine system, our digestive system, all these systems, they are connected and correlated. And so these children are already in a state of chronic inflammation sometimes. And so if we're thinking about it from a total load, whole body perspective, some foods may be adding as a stressor rather than nourishment sometimes. A gluten-free, casein-free diet alone is not going to make as big of an impact on health and development as a healthy, gluten-free, casein-free, and soy-free diet. And I want to elaborate a little bit further on this, because we've talked before about the research gap that exists, where some research will come out, and it takes approximately 20 years, 17 to 20 years, for research to be commonly, widely known, and accepted mainstream by society and the medical community. Well, as I've said before, I hope that we can dramatically close that research gap with the internet in the last 2 decades and all of that. So hopefully we see some improvements there. But where I'm going with this is that research gap, we're finally just now in the last decade starting to really see more researchers looking into the impacts of diet on children with autism and on children with other neurodevelopmental disorders like ADHD and others. And that's exciting, but sometimes if you look at the studies, you think to yourself, well, of course they didn't find that it helped improve children's symptoms because they didn't do it right. Which we're going to keep getting further into this, but really what we are finding more and more now is that it's not just enough these days because of our health system, or not our health, well, yes, our health system, but also our food systems and how the different ingredients in our food supplies. It's just the total load has added up so much that it's not enough now to just focus on being gluten-free and casein-free. Now we need to think more about healthy gluten-free, casein-free, and soy-free diets. And why soy-free in addition? Because from a protein perspective, molecularly, it's kind of similar to gluten and casein from the body's perspective. All 3 of these can create disruption for the gut lining and can create those addictive like drives and cravings from children. So, I want to talk more about a study that came out in 2018 by Dr. James Adams and his team called the Comprehensive Nutritional and Dietary Intervention for Autism Spectrum Disorder, a randomized controlled 12-month trial. And in this study, they listed the guidelines for a healthy, gluten-free, casein-free, soy-free diet. Here are those guidelines. Adequate intake of a variety of vegetables, including leafy greens and fruit, preferably whole fruits, organic whenever possible. Adequate protein quality and intake. Adequate but not excessive caloric intake. Minimal consumption of junk foods and replacement with healthy snacks that are healthy, gluten-free, casein-free, and soy-free, and are avoiding artificial flavors, colors, and preservatives. One of my nutrition mentors who created the Bioindividual Nutrition Institute, which I'm a student of, her name's Julie Matthews. She is a renowned nutritionist in the world of autism nutrition, and you may have heard me talk about her in episode 1 and 2, how my chronic illness was a catalyst to a career change. She was one of the first nutritionists that I found that was really laying out the research that has been done and going really deep into it. And so I always recommend checking her out. I've learned so much from her. She was involved in this study with Dr. James Adams, James, he goes by both. And she was one of 2 of the nutritionists in this study, and she has written a very comprehensive breakdown of the results of the study but it's quite lengthy and detailed. It's very, very interesting though. And I've linked it in the accompanying blog to this podcast, which I'll link in the show notes below if you're interested in reading more about it. But you can also find her work, this write-up, at nourishinghope.com as well. But this is what she had to say about that study. She said, "This study supports what many practitioners and parents have been seeing in practice all along. Finally, we have conclusive evidence that nutritional and dietary intervention is effective at improving nonverbal IQ, autism symptoms, and developmental age in children and adults with autism spectrum disorders. There were improvements in anxiety, mood, aggression, hyperactivity, focus, and more. Thus, I'm thrilled to share the results of this one-year comprehensive study with all of you. The outcomes were life-changing for many of the children that participated, for their families and communities too." Again, you can read more about that on nourishinghope.com, and I've also linked it in the show notes below in my accompanying blog to this podcast. This study is groundbreaking, and it's one of the best out there to show the efficacy and the power of nutrition and supplementation on autism, which is amazing. And while this study is specific to autism, it is my professional observations and experiences that these results can be replicated in demographics beyond just those children who have autism spectrum disorders. Further, to all children with neurodevelopmental disorders and comorbid health conditions. There are, like I said, children who are complex picky eaters that benefit tremendously from a diet of this nature, who do not have clinical presentation of autism symptoms or a presence of a neurodevelopmental disorder. Maybe they're just a complex picky eater, but they still fall within this realm and they still benefit greatly from this approach. So just to note, this study was a healthy, gluten-free, casein-free, soy-free diet in addition to supplementation protocol. And again, the study removed soy, which I also encourage my clients to remove soy as well from their diet for their children if it feels manageable to them. But just depends on where they're starting. If soy is easy to remove initially, then I encourage it, but it might be something that we have to work towards, especially with children who have complex picky eating. You do not want to just go switching their foods cold turkey, because you might create some type of distrust with the child, which creates further food jags or further them cutting foods out of their food repertoire, and that's what we do not want. We want to add before we start taking away. So again, just something to note, you want to be really mindful about these types of changes with children who are sensitive, highly sensitive beings, and they already have children who already have these complex picky eating needs. But back to soy. Soy can be inflammatory for various reasons as well. As I mentioned, it's similar to the gluten and casein proteins, but some forms of soy also encourage the release of free glutamate in the body, which can be neuroexcitatory, over neuroexcitatory for individuals with complex picky eating, autism, and neurodevelopmental disorders, developmental delays. And so it creates, again, this addictive type of drive that looks like, oh, well, this kid really loves this food, but really it's a biochemical reason going on here. So here are some of the considerations that someone might want to think about before taking on a gluten-free, casein-free diet with their child and family. While it's not required, I do like to advise my clients to consider biomarker testing before starting the diet if you're someone that needs biomarker testing before starting the diet. Some people are like, no, I don't need that. I can see very clearly that this child has an issue to this food, so I'm going to remove it right away. But some parents like that black and white concrete biomarker testing as a baseline to say, yep, this is where we're starting. But here's the thing, is that once you start the elimination phase of the diet, the tests for celiac disease and food intolerances and sensitivities, they may not be accurate baseline readings, like a true look at where you're starting once you start that elimination phase of the diet. So if the black and white baseline data matters to you, then you need to explore those testing options with your child's team prior to taking on the elimination phase of a specialized diet. Try to get what testing you can through your insurance coverage, of course, but then, and your child's healthcare providers. So if possible, something like an IgE and or an IgG blood test can be ordered through most pediatricians and family medicine doctors, but you'll need to, understand and explain to them why you are interested in having these tests done. So again, I do encourage you to speak with someone professionally about it so that you feel like you're getting the guidance that you need. But note that the IgE is really looking for true food allergies, like that immediate immune system response, anaphylactic allergies, while again the IgG is looking more at the delayed antibody responses to food sensitivities. Be sure that you're aligning yourself with doctors and practitioners who will work with you and support your journey. These food sensitivity tests should be seen as a tool, but not the full picture of what's happening. Some traditional allopathic medicine doctors are hesitant to order these tests because they can result in false negatives and false positives. But additionally, keep in mind that these Ig biomarkers are only testing the antibodies present in response to the proteins in food at that time. It's a snapshot in time, and it's only looking at the proteins, the antibodies response to the proteins, the immune system response to the proteins. But there's more than just protein in your food. Some children are reacting to more than just the proteins. They might be reacting to foods that wouldn't necessarily show up on these tests. So, for example, like they're reacting to the salicylates in berries. You would not see that show up on these conventional standard Ig biomarker tests. We're seeing more and more of these kiddos who have these food intolerances and sensitivities, and their symptoms of inflammation are not being recognized for what they are. Various different behavioral, cognitive, physical symptoms that are really food intolerances. Some that would fall under behavioral or cognitive would be, but are not limited to, strong preferences for foods, those seemingly addictive like drives and cravings, food refusal and self-restriction of foods, hyperactivity, aggression, rage, social withdrawal, meltdowns and tantrums, repetitive behaviors, strangely timed inappropriate laughter, and an increased anxiety. And different physical symptoms might look like red ears and or cheeks, food cravings again, constipation, diarrhea, eczema, or like that chicken skin or other skin reactions like hives or rashes, gastrointestinal pain or discomfort, and that intestinal hyperpermeability, leaky gut, which we talked about in the previous episode. And again, these are just some of the symptoms that you may see. This is not the full gamut even. The other test that you might consider running is that celiac disease test before starting a gluten-free diet. And the reason for testing before is because once you start the diet, the results could result in a false negative, saying that gluten is okay and it's tolerable for your child. I didn't know this when I personally removed gluten and casein from my own diet, and so now I just like to be sure to note that for people, that they have that information going into it. Most experts in the fields of functional nutrition and functional medicine, in autoimmunity and neurodevelopmental disorders, most of them recommend trialing the gluten-free and casein-free diet for at least 6 months, regardless of what test results indicate. Often, the best way that you can really determine the impacts of how a food is responding with you, again, it's through elimination and reintroduction. Very mindfully, and often you need to do it in a guided way, especially if you've got a kiddo with complex picky eating. From there, you can really work with what you observe with your child, and you can get really in tune with your child and prepare yourself to feel like a food detective. And if you're concerned about nutritional status or you need guided support with this, especially again if your child's a complex picky eater, consult with a professional who can guide you through this. I have seen diet improve children's health and development in so many different ways. Adults too. I often hear that parents and siblings see improvements in their health and wellness while working with the families that I serve. We'll be working with the child, but maybe the mom, her migraines get better, or maybe someone's skin improves, or someone loses the stubborn weight they've been trying to lose, or anxiety improves, different improvements that can be seen across the family. It's really remarkable. Here are some of the reported improvements in my clients on healthy, gluten-free, casein-free diets. Increased willingness to try new foods, better attention and behavior, digestive improvements, a decrease in sensory challenges, improved speech and language skills, eye contact improvements, better motor improvements, better sleep, potty training progress, and so much more. So you really see, oftentimes parents will describe, or professionals will describe, when you start talking about these dietary changes, you may hear people say, it was like a fog had been lifted. It was like a veil had been lifted. It was like the lights turned on. It really truly is remarkable to see for some of these children how they improve in such a fast way. And again, it's not like that for all children. It varies depending on the kiddo, right? This is bio-individual. But this is a good starting point foundation to think about and consider for these demographics of children. So what is the connection? Here are those 5 connections to explore in regards to adopting a healthy, gluten-free, casein-free diet and how it may improve your child's picky eating and their neurodevelopment. This list is obviously not exhaustive. There are a variety of reasons that this diet is beneficial for a starting foundational step for generally many other special diets as well that someone may eventually progress to. But these are just 5 of these connections. So 1, it supports the repair of the gut lining and the blood-brain barrier by removing it removing these protein molecules as offenders while you're allowing these cells to repair and heal. As I mentioned earlier, there is a molecular similarity of the gluten and casein proteins, and there's also a similarity between the cells of the gut lining and the blood-brain barrier. Children with autism, neurodevelopmental disorders, and severely restricted complex picky eating are more likely to have this increased hyperpermeability of the intestinal lining, which places them at a risk for a weakened blood-brain barrier integrity as well. In infants and very young children, that blood-brain barrier is even more vulnerable because it's still developing. So when these barriers are already inflamed or compromised or not fully developed even yet, gluten and casein can be over-aggressive, promoting and further exacerbating leaky gut or intestinal hyperpermeability. And this hyperpermeability spirals into the creation of more food and environmental sensitivities over time. And as pathogens and food antigens enter the bloodstream from that digestive tract, the longer it's left imbalanced, the longer it continues to accrue damage, and the more symptoms appear and the more difficult it is to resolve. And this is directly triggering the immune system to respond with antibodies against the proteins, gluten, and casein. Healing and sealing the gut by allowing it time to heal without these proteins can be correlated to helping slow down the development of further food intolerances, sensitivities, and autoimmune cascades. If you're new to the topic of gut health, again, go back and listen to my episode 6, How Gut Health Impacts Your Child's Health and Development, where I cover some very introductory terms and beginner knowledge in that episode on gut health that will pair well with this one. The second connection to consider when thinking about gluten-free, casein-free diets for kids with picky eating, autism, developmental delays, and other neurodevelopmental disorders is that our food is not like what it used to be. The quality of our food today is very different than before. It's not as simple as just thinking about this in terms of gluten and casein protein molecules, unfortunately. And that's why I was sure to highlight that 2018 study and the importance of a healthy gluten and casein and soy-free diet. We also need to consider the food quality that these children are eating. Our wheat today is so very different than the wheat that was consumed generations ago. For starters, we are not soaking or sprouting wheat or grains these days, and that renders it much less digestible to begin with. I cannot stress enough the importance of aiming for organic options whenever possible to avoid agricultural residue chemicals like glyphosate-based herbicides and genetically modified foods. While the U.S. isn't currently producing GMO wheat, to my knowledge the last time I checked, essentially all conventionally grown wheat that is harvested in the United States, it is sprayed with glyphosate-based herbicides as a drying agent before harvest, and it cannot be washed off. A third connection to consider is opioids, the opioid excess theory. Could your child be addicted to their favorite foods? Do we potentially have an opioid crisis in our children? Perhaps. I find this very fascinating clinically, and I hope to see more and more research emerge on these biochemical mechanisms. but in short summary, gluten and casein protein molecules, when they're not being broken down properly and they're not being digested properly, they enter into the bloodstream via that leaky gut, which we talked about in the last episode, and they are able to migrate to the brain and central nervous system, inserting into receptors that cause a myriad of behavioral and or some behavioral or physical symptoms. While this research that I'm about to share is specific to autism, I think it's really important to highlight how this theory could be impacting many children, particularly those with complex picky eating, especially those who are limited mostly to gluten and casein dairy-containing foods, as well as other children with neurodevelopmental disorders and special needs. So this is a quote that I'm about to read. It is from a study that was published in 2005 online, and it is called Biochemical Aspects in Autism Spectrum Disorders, Updating the Opioid Excess Theory and Presenting New Opportunities for Biomedical Intervention. And it's by Paul Whiteley and Paul Shattuck. And here's a direct quote that talks a little bit more about this opioid excess theory, and I liked the way they worded it, so I wanted to pull it right into this to help explain more. The premise of this theory is that autism is the result of a metabolic disorder. Peptides with opioid activity derived from dietary sources, in particular foods that contain gluten and casein, pass through an abnormally permeable intestinal membrane and enter the central nervous system to exert an effect on neurotransmission, as well as producing other physiological-based symptoms. End quote. I've seen many children, toddlers especially, who have not had a diagnosis or presentation of autism or any other neurodevelopmental disorder, but they had this complex, restricted picky eating. And this approach helped them. As demonstrated through my work, there are many reasons why a child will exhibit picky eating. Sometimes it's typical picky eating, and sometimes it's not. And by typical picky eating, I mean in that toddler to preschool age where they may be experiencing fear of new or new-ish, newer foods to them, and it is completely a developmentally appropriate phase for them in that age, in that time frame. The parents of children who they're only eating a few foods, the children are only eating a few foods. They eat mostly pizza, mac and cheese, noodles, chicken nuggets, waffles. These are like the most common that are coming from me. Crackers, cookies. They want these like starchy, carby, cheesy, crunchy, fall aparty, fluffy, noodly types of foods. These are usually the children that often respond pretty quickly to nutritional changes. And some of those kiddos, you also have to take into consideration what's going on structurally, functionally, from oral motor perspective, and a sensory perspective. That also might have something to do with it. But again, that biochemical nutritional aspect of it may be influencing, the sensory aspect. So I think it's always worth exploring. Those are usually the children, like I said, that respond pretty quickly to those nutritional changes. Not only could their bodies be craving that gluten and that dairy because of the opioid excess response, but also oftentimes those foods in their highly processed forms, these conventional foods, they have artificial food additives and chemicals and dyes and flavors that could also be causing an addictive like craving or response. As their diets are cleaned up and as the antibodies to gluten and to casein leave the body, most children will experience a remarkable expansion in their food repertoire. The fourth connection is that we need to consider that the child's GI issues may not be separate from their behavior, development, and their overall well-being. So this goes back to that gut-brain connection. Gastrointestinal disorders and digestive improvements have also been the benefits of children and individuals on gluten-free and casein-free diets. So further thoughts on the opioid excess theory. What digestive symptom is notoriously correlated with side effects of opioid medication? Constipation. Many children who are complex picky eaters or who have neurodevelopmental disorders experience a comorbid constipation, diarrhea, and or alternation between the two. This can be especially challenging when your child has a hard time with communication. Some children will posture, they'll hang over the furniture or their parents' bodies sometimes for pressure on their stomachs as an adaptive pain relief attempt. So if you're feeling like your child's always wanting to lay all over you, kind of wrangle all over you, sometimes that's related to sensory regulation, but sometimes it can be related to their digestive feelings, like particularly if a kiddo is putting their belly over you in some way, of over wanting to be over your shoulder, over your lap, or however, consider that it might be posturing. If a child is feeling uncomfortable or they're in a chronic state of inflammation, it's very possible that they may experience increased anxiety or sensitivity environmentally and emotionally, and so much more. Countless parents have told me that their child's personalities literally improved for the better. They've said, they're so much more resilient and easygoing, or we were just shocked that they just ate what we served. Once more, I don't want to make blanket statements. Honestly though, a healthy, gluten-free, casein-free diet as a starting point, even if it's temporary, has time and time again been anecdotally reported to bring a wide variety of improvements to children and families around the world. A 2009 parental survey of over 27,000 parents by the Autism Research Institute, they surveyed that many parents, and there were 3,593 parents who had tried the gluten-free, casein-free diets with their children, and of that 3,593, 69% of those children got better as reported by their parents. So it's definitely worth considering a healthy, gluten-free, casein-free diet as a foundational starting place for families who are exploring biomedical treatments, and that includes holistic functional nutrition and lifestyle interventions. The fifth connection that I want to highlight today is that reducing gluten and casein proteins can reduce the autoimmune response or the potential for developing one, and overall inflammation for many of these kiddos. And this goes back to those points that I previously made on healing and sealing the gut lining. In order to prevent those proteins from being able to enter the bloodstream outside of the digestive tract where they were never supposed to be in the first place. So, are you convinced of the incredible potential yet that this diet can have for these children? This is a key reason to consider healthy, nutrient-dense, gluten and casein-free diets. For some children and individuals, not only those on the spectrum, gluten and casein molecules can initiate the body's immune system to respond against itself, going after the body's own proteins. symptoms of this autoimmune response on the surface can sometimes be seen as behavioral symptoms, especially in young children or children who are pre-verbal children. If clinicians aren't certain of what signs and biomarkers to explore for a root cause, these can go overlooked. So for children with autism and neurodevelopmental disorders, the first step is often developmental therapy interventions like speech language, feeding therapy, occupational therapy, physical therapy, behavioral therapies. These are wonderful services, don't get me wrong. Before transitioning into seeing only clients through Speaking of Health and Wellness, I was an early intervention speech language pathologist and feeding specialist, and I truly loved serving that birth to 3 age group. I reached a point in my personal journey where I couldn't stop thinking, what if we looked at these conditions differently as whole body conditions? What if the first step was to consider how to bring their central nervous systems into better balance through diet and lifestyle interventions prior or in tandem to traditional therapies? Could they be in a better cognitive space or disposition to fully receive the benefits of therapies to their maximum potential versus where they're clearly dysregulated? Absolutely. There were some days, especially there towards the end of my time in early intervention, where I was seeing clients with early intervention in my early intervention job. And then I had built Speaking of Health and Wellness, and I was slowly inching out of early intervention and going more full-time in Speaking of Health and Wellness. And I can remember just it being so painful to not give all of the knowledge and strategies and resources that I had to give because it was a different setting. And because it's a different setting, it's, it wasn't my private practice. I'm in there to be a speech language pathologist and a feeding therapist and be there for that family in the capacity that I was there to be for. So it was just a different role in a different setting where I couldn't share these strategies that I am now primarily using in Speaking of Health and Wellness within my distance coaching, where we're looking at what foods work or do not work for your child's body. Let's unpack the GFCF diet, gluten-free, casein-free. I'm going to use it interchangeably. Let's unpack the diet itself a little bit more. Is it all or nothing? What happens if they accidentally eat something that is not gluten and casein free? I will get right to the point for you. It must be all or nothing at first and for a while. If you're planning to transition to a gluten-free, casein-free diet, I suggest adopting it gradually for your child. Expect it to take time just to transition fully to having a healthy, gluten-free, casein-free diet. This is not something that is easily done overnight. When you finally reach the stage of your child completely eating a gluten-free, casein-free diet, mark your calendar and make a note. From there, it's widely suggested that it can be at least 6 months minimum to judge its true effectiveness. I believe it's worth a full commitment, at least for a year, and then reassess. Note that once again, the study that I shared, the 2018 study, that's one of the best out there on this topic, showing really great health and development improvements after a full year of dietary intervention and supplementation. Generally speaking, it's estimated that it takes approximately 3 weeks of complete and total elimination for the casein antibodies to leave the system, to leave the body. And it takes approximately 4 to 6 months for complete elimination for gluten antibodies to leave the system. So really, you can't judge the true effectiveness of the diet until 6 months with no oops moments. I will never ever forget watching an online interview during my own health journey where an autoimmunity expert, Dr. Amy Myers, for those of you who might know her, in one of her interviews, she said that just one bite of gluten can send your immune system into a hyper state, into triggered response for 4 to 6 months, even when you've been gluten-free. Yikes. So, a cheat is not worth it with gluten because it triggers your immune system for months, even after just one bite. But know that mistakes are bound to happen and have grace for yourself and for the process. A decent portion of the previously conducted literature on the GFCF diet, especially those studying the diet's impact on autism, oftentimes those studies, they were not trialed long enough. A few days or weeks to evaluate the true capacity of a healthy, gluten-free, casein-free diet on your child's health and development is just simply not long enough. Further, many of these studies are also not using a healthy, gluten-free, casein-free diet. They're focused mostly just on gluten-free, casein-free, but it may not be healthy. And sometimes they're not even using gluten-free and casein-free together. They're using them exclusively, not mutually. So when you see journalists or the mainstream media who are discrediting the impacts of gluten-free, casein-free diets on autism typically, look closer at the studies that are being cited. Are they studies with short trial periods, too short to really tell their impacts? Are they really following a healthy gluten and casein-free diet? More often than not, it's not the full picture. Thankfully, through parents telling their families stories and collaborating with functional practitioners and providers around the globe, the paradigm is shifting. This is becoming more well-known and more considered and adopted by more and more families around the world. And that 2018 study by Dr. James Adams and his team cannot be over-celebrated. It is truly groundbreaking work, and it's well worth the print and the read. It would also be advantageous to look deeper into the exceptional work of the involved contributors that were on that team who did that study, because they're all really great professionals in the world of autism that you can learn more from. But I've got that study linked directly in the accompanying blog to this podcast, linked in the show notes, so you can check that out. You can learn way more in depth on this topic. This is just a piece of the blog that I have put into the episode today. If you are the parent of a child with complex picky eating or developmental delays and or neurodevelopmental disorders or autism, and you are interested in exploring holistic nutrition and low toxicant living further, if you're interested in speaking with me and learning more about distance coaching options, you can visit speakingofhealthandwellness.com to learn more about the distance coaching packages that I offer. And if they look like a good fit for you, you can schedule a complimentary 15 to 30 minute discovery call that I offer to make sure that we're a good fit before any commitments are made. I would be honored to support you. I would be honored to speak with you to see if I would be the right fit. And again, that link is in the show notes, and you can self-schedule a complimentary discovery call with me to see if we would be a good fit to work together for distance coaching. I would be honored to support your family. I hope that this podcast episode has supported you. I hope that this information has resonated with you, and I hope that you have an incredible remainder of your day, whether that's the remainder of your morning, the remainder of your afternoon, or the remainder of your night. Thank you for giving me your time today. Thank you for learning with me, for listening, for taking the time. Until next time, take care, and I will talk to you soon. Thanks again for listening to Speaking of Health and Wellness, the podcast. I'm so grateful you've taken the time. For any of the references mentioned in the show, head over to speakingofhealthandwellness.com. If this episode resonated with you or inspired you, it would mean so much to me if you took a moment to subscribe, write a review, share it on social media, or with someone in your life who could really benefit from this information. Your support helps this podcast and the overall message and mission of Speaking of Health and Wellness reach more people. If you share on Instagram, tag me so I can personally thank you for listening. If you're on Facebook, come join our free community group of like-minded parents and professionals. The direct link is in the podcast description. I hope that you have a wonderful rest of your day. Thanks again so much, and take care.